I have a question for...
I wanted to comment on that one, Senator Royale.
Yeah, okay.
Is that okay? Yeah.
Yeah,
of
sure.
course.
We absolutely agree that prevention is vital, and you see me in the part doing the policy aspect right now, but the other second main thing we do is prevention, and we do by youth, for youth prevention. So it's all young people who do our the drug education. They do a tremendous amount of research, and for, like Mrs. Anderson was saying, there's new drugs, coming out all the time. That means we're on top of that as well, because we're getting it from the young people who are exposed to these things, where generally it's not, the adults necessarily getting this right away. So we have a drug education resource. We have a website, and we also we're happy to give you more information. I can send around some of our prevention stuff if you're interested, and ours is different than traditional drug education in that it's 100% by youth, for youth. It's not, a program where they have a couple of youth on board. And we also have, each section has what, chemical components, what to be very careful of, and the other parts of the website are, if it also talks to youth who are experimenting. So instead of course, we advocate that, for youth that are experimenting, we're not going to say, well, don't talk to us and go away. We don't want to shut that door. So we have potential solutions, and we have quizzes they can take of whether, how they can gauge if they need to seek out for help, or what other resources are. So I just wanted to let the committee know there are lots of other creative prevention and education programs going on that you may not be hearing about, because I don't know if those are being called before committee or not. And I'm happy to provide some of the resources if you're interested. And we would emphasize that it's very important to have it youth drug education. It's really different to have a police officer, for example, to come in, because that's perhaps effective in some ways. Not all young people are going to feel comfortable enough to approach them afterwards, perhaps, or if they've already had problems with police, or to try and create, all of the work we do is we know this is so complicated and there's not one simple solution, so let's try and come up with creative solutions that are not just one faceted, that we can have education programs that are abstinence based, and we can have them that are harm reduction based, and we can have them that are 100% youth based.
Thank you. Senator Joyal?
Yeah, another question for Ms. Lyons. I don't know if you were listening when Mr. Bradzer testified. He was one of our first witnesses. He referred to a court decision in relation to the interpretation of school grounds.
Oh, I missed that part.
You missed that part?
Yeah.
Okay. Because it seems that there has been already a court case that has struck down that expression in the criminal code, which is at 179 of the code, which refer to specifically to the same geographic situation, schoolyard and school ground. The term school ground is exactly the same. So I was wondering if you were aware, of course, of that court decision and where it stands and what impact it could have in the interpretation that you are providing to us.
I'm not, sorry. I'm not aware of it, and I missed Mr. Bratzer's, that part of his testimony. I apologize.
No, that's fine. If I may, a last question. Seems to, according to the witnesses we heard today, that there's an increase of consumption that is really very high. 30% is a very high figure, which means that in a short period of time we will increase 100%. That's. I was reading in a Montreal paper last week that even senior are, and what will happen with all those baby boomers retiring? Some of them have tried it before. It's not a phenomenon that will be decreasing. It's a phenomenon that is there. We can, of course, fight the organized crime and so on. We're totally agreeing with that. But it seems that it's a society phenomenon that is not really only addressing itself to the youth population, but now with the generation that has, I should say, experimented the drug in the marijuana in the 70s. They are now 60s or 70s even, and they know the effect and so on. So, in other words, the demand will stay there. The demands of marijuana will stay there. And it seems to me that as much as I agree that organized crime is those who profit the most of the business, there is still another very important element into that equation that I think we still underestimate in terms of the initiative that various levels of government and various levels of school authorities, and when I say school authorities, I mean also universities and so on, because even though you're freer on a campus, nevertheless, the phenomenon is still there, and I think that many of us can testify on it. So don't you feel that we're still underestimating the impact of the level of consumption in Canada at all levels of society?
I think we come from a perspective of we don't believe that a drug-free world is possible, or perhaps in our lifetime. You know, the UN adopted the drug-free world in 2000, so they were going to have a drug-free world by 2010, and we know that hasn't happened. From our perspective, in our near future, we don't foresee a world of no drugs at all, particularly when we have substances like alcohol, which depends how you classify it, can be a drug and is extremely harmful, and very, you know, it's also used in very socially accepted ways and non-harmful ways. So for us, we come from this realistic perception, and because we come from that perception, we advocate for certain harm reduction measures, or we don't necessarily, because we come from a different perspective, things like Bill S10 concern us in terms of we don't think it's going to stop drug use, or we don't think it's going to, that people will just, not everyone is going to understand. Of course, this bill will have effects perhaps of going after the cartels and stopping them. That may be very well part of it, but our membership, we just don't see young people just stopping doing drugs. So that's the perspective that we come from.
Thank you.
Senator Baker.
Well, this will certainly impact upon people who are at the low end, because that's where the minimum sentences are now going to take effect. And I was thinking when Senator Joyelle was asking you about these drugs, Ritalin, for example. Ritalin is a controlled substance. And if you pass it in a school, there are children attending elementary school who take Ritalin. And that's a controlled substance. That's a dangerous drug, so as defined by the Controlled Drugs and Substances Act. Let me ask you this question, since prevention is the main object of this bill. And this bill, when it passes, and it will pass, I shouldn't be so well, it will pass, will have some very stiff penalties. As you pointed out, you pass a Tylenol C in a university, and you're that Schedule 1, it's life imprisonment, minimum sentence, 2 years in jail. Now, to me, that would be a great advertisement in a school. To me. I mean, it's a shocker. And since we all agree that prevention is the whole object, I mean, we don't want to pass a bill here that's going to be a secret, you know, ignorance of the law is no excuse, we got you now, you know. No, this is a preventive measure, according to the government. The government wants this to be preventive. So how would you think that we should, as a committee, because we not only examine the legislation, but we can make comments about the legislation, make recommendations as to what should be done with the passage of this very, what some people would call draconian piece of legislation. How do you think we should, what do you think we should recommend to the government as far as explaining this and making it a preventative tool? What should we do? Should we have an advertising campaign suggested, or what can be done to spread the message of this new law in effect in Canada?
Can I just clarify that if the bill passes, we're going to have these, you know, potentially very long sentences, and how to spread the word about that so people know about the...
Well, you don't want to shock, you don't want to, I mean, the intent is not to put somebody in jail who didn't know
exactly
that if they were committing an offense, they would, you know, ignorance of the law is not a defense. Section 19 of the Criminal Code. So
how to implement people are very aware of it.
How can we now use this? I mean, this is a very serious bill So how can we use it? Would you suggest an advertising campaign, a massive media campaign?
I think it
over
would
this?
be absolutely, it would be, that's the only ethical thing I think that the government could do, and I don't know if this falls under Health Canada or which jurisdiction, but people would have to know, and because the penalties are so severe, and because they're mandatory minimum sentences, so there's if the bill passes, that there's not a lot of room to move, where you don't have the, well, it was my first time, my first offense, or what have you, the judge loses their discretion. That I think those, I don't know how, I guess major advertising campaigns or something, it would be important to involve youth in this. If we hope not, the bill passes in this form, you would need to have youth involved in those messaging, so it gets to the right people, to have young people involved. Do you know what I mean? And to have elderly people involved when they're coming up with messages for elderly people, because they know they speak the same language, to make sure that people aren't being swept up under this bill without knowing that it's even on the books.
What do you think, Ms. Anderson? Wouldn't you think that a young person would have to be crazy to exchange a pill for which they would go to jail? Minimum 2 years. It would be a great advertising. Don't you think that would be a good, or would it have an effect?
I guess that's $1 million question, isn't it? Definitely education is a huge thing, and it has to be done through advertising, through, programming, whatever. It definitely needs to get out there. Until Chelsea died, I really didn't think drugs was, something I really had to discuss with my children. Mm-hmm. And now that this has happened, of course, I've talked to my kids, and, I've questioned them and drilled them, and, I've been the parent and, pointed my finger and stomped my feet, the whole works. But if we don't educate the young as they get older, there's going to be that gap. But with that, we have to educate everybody across the board, definitely. And like I said, be it through programming, advertising, whatever, it's definitely something that should be done. These people need to know that message is out there, and that, if you do the crime, you got to do the time. And that's it's the law. It's protecting society.
Thank you, Senator Baker. Thank you both very much. We've kept you longer than we assured you we would, and that's because people thought it was important to hear what you had to tell us. And we truly appreciate the presence, both of you.
Thank you very much.
Thank you.
And colleagues, we will now suspend for a couple of moments.